Welcome to EDH 502, Unit 3, Presentation 1. In this presentation, we will talk about Applied Behavior Analysis or ABA. ABA is the science in which procedures derived from the principles of learning are systematically applied to improve socially significant behavior and to demonstrate experimentally that the procedures used were responsible for the improvement in behavior. In other words, it is a scientific approach to understand why people do what they do and helping them make meaningful changes in their behaviors. So, the core concept of ABA is that the consequences of what we do affect what we learn and what we will do in the future. For example, people work hard and do a good job at their work because they want to earn money. Another example would be that you do a good deed because you feel good that you helped someone, and so forth. Now, I would like you to stop for a minute and think about some more examples. The word applied in applied behavior analysis is critical because the behavior is selected for treatment because it is socially significant for the learner. It will improve one's life in the area of social, language, academic, daily living, self-care, vocational, and or leisure skills. The clinical aspect of applied behavioral analysis is that it focuses on certain targeted behaviors, and therefore, the question that one should ask is what behaviors should be targeted for change? Applied behavioral analysis has been used for a number of research reasons as well, because through applied behavioral analysis you can figure out and actually say that it was the intervention that caused an improvement in the targeted behavior. Positive reinforcement is critical in the ABA approach because in this approach you identify what motivates each individual child. Now we have to remember each child is different, so the things that would motivate them will be different. So you must take the time to figure out what motivates the child. Teaching must use what is motivating to the child, not what we think should be motivating to the child. So, once again, really critical that you know your student, you know what factors would motivate the child. Once we figure that out, we teach the child by teaching them new skills, and we do these in small steps and reward the child as we move along, therefore keeping the child motivated to learn. ABA has high levels of accountability and effectiveness. ABA assumes that if a child is not learning, it is not the child's fault, but it is our fault, and we must change what we are teaching. In fact, we must continue to try different methods of teaching the child until we find one that works. ABA is the best method for finding what works for the child and what would motivate the child. When when we're using ABA, we never blame the child if he or she is not learning. It is believed that it is our responsibility to figure out how to teach whatever the child needs to learn. However, what is critical is that once again we are focusing on a target behavior, and while we're working around the child and trying to change the child's behavior. There are a number of comprehensive ABA programs that are being used today. One of the earliest versions focused on discrete trial training. The other comprehensive ABA programs now include a variety of behavioral teaching strategies, and they definitely include the discrete trial training, but they also include natural environment training. They include verbal behavior, challenging behavior. Their focus is on data collection and also for programming for generalization. Now let's talk about discrete trial training. Discrete trial training is a method of teaching in simplified and structured steps. Instead of teaching an entire skill in one go, the skill is broken down and built up using discrete trials that teach each step one at a time. Sometimes you might see the term discrete trial procedure, discrete trial teaching, or discrete trial instruction, but these terms are all the same as discrete trial training. So the focus on discrete trial training is instruction followed by a correct response and a reward, or instruction, incorrect response, correction. So just to give you an example, teacher places one red and one blue card on the table in front of student X. The teacher says, point to yellow. The student responds by pointing to the yellow card. The teacher would say, that's right, good job. There would be a very short pause before a new discrete trial would begin. So here there was instruction. The instruction was the fact that the teacher placed one red and one blue card. The instruction probably happened prior to this, so we are assuming that some sort of instruction has happened. The teacher now places the two cards in front of student X. The response is correct, and therefore the student rewards the student by saying, that's right, great job. So we are using verbal reinforcement here. Once that trial is over, there's a short pause and the teacher moves on to the next trial. Just to give you another example. So think about this one now. Teacher places one card, one red and one blue, in front of student X. The teacher says, point to the blue. If the student does not point to the correct card, the teacher will tell them what the correct card is and then move forward to the next trial. So if you think about it, a discrete trial can be broken down into a number of steps. One is an antecedent, second is the prompt, third is the response, and then it would be a consequence for a correct response and a consequence for the incorrect response, followed by an interval which would lead to the next trial, new trial. Thus, we find that within discrete trial training, each trial has a very specific set of steps that are clearly defined and scripted and always need to be followed. Clearly defined steps allow the teachers and program supervisors to identify what specific teaching methods or tactics are working and which ones are not. Therefore, we can say that discrete trial training provides a lot of structure for the learning interaction to happen. It provides a large number of learning opportunities in a very small time, and it is proven by hundreds of studies to be an effective teaching procedure. In other words, there is a lot of research out there that talks about discrete trial training and shows us how discrete trial training has been successful. Natural environment training utilizes principles of applied behavioral analysis to teach in the natural environment or the real world. Capturing the motivation of the child to teach new skills is especially important. For example, if one of the skills that we need to teach a child is to vocally request items, then in the natural training environment or natural environment training, the situation may be arranged so that in order for the child to gain access to his or her stuff or whatever they need, which is slightly out, would be placed slightly out of reach, so that he or she would have to ask for it. And when the child actually vocally requests for the item, the child is reinforced by giving him or her the item. So the basic approach in a natural environment training involves teaching in the natural environment, setting up a situation where the child is motivated to perform the task. You wait for the child to initiate the vocal response, you prompt the correct behavior, and you reinforce the behavior by giving student the access to a toy or the object that they want. So when we compare natural environment training to discrete trial training, we find that both follow the ABA concept, but the natural environment training is a much more natural approach. It is less structured. It looks more like a typical interaction that would happen between the student and the teacher, for example. It is great for teaching students how to play, or also with social skills. It is also great for establishing generalization skills that have been taught while using the discrete trial training. You will always find there some students who respond better to a natural environment training than to the discrete trial training, and it is once again a strategy that has been proven by dozens of studies to be an effective teaching procedure. When we talk about challenging behavior, we are thinking about aggression, self injury, self stimulatory behaviors, or tantrums. Applied behavioral analysis assumes that children are getting something they want from the challenging behavior, which could be attention, escape, something tangible. That would be they would want access to toys or food, or some kind of a sensory stimulation. And this is what it bases its instruction on. What it wants to do is when you're working with applied behavioral analysis concepts or strategies, you want to figure out what the function of the behavior is. And once you figure that out, you create a hypothesis and you put an intervention in place to make sure that you are not encouraging by reinforcing the negative behaviors. One very critical thing to remember is autism is not a cause of bad behavior, and therefore we must really figure out what the function of the behavior is, because it is the function of the behavior which is the causing the challenging behavior. So, one of the first things you would want to do when trying to figure out what the cause of the challenging behavior is would be to conduct a functional behavior assessment. This means that you assess what the child is getting from their challenging behavior. Once you figure that out, the next step would be to not to give it to them anymore when they have the behavior. So, for example, if a student is working for a tangible object, every time and their way of getting the tangible object is crying, then you do not want to give the student the tangible object until or unless they stop crying and they actually request for the toy. You want to make sure that you teach the child a more appropriate behavior that will get them what they want. For example, asking for a break, playing with a toy, asking for attention instead of crying, screaming, shouting, etc. And we will be talking about functional behavioral assessment in details in the next presentation. Whenever you're working with kids, the one thing that you have to remember is data. It is very, very critical that you have collected a good amount of quality data to figure out whether the child is making progress or not. You could be collecting data on frequency of challenging behaviors. You could be collecting data on percentage of correct responses. And once you have, and there could be a number of examples, and once you have collected the data, you want to make sure the data are graphed after each teaching session, and the percentage of correct should be increasing over time if the child is learning. If, for example, the child is not learning, then you need to stop and rethink your intervention and modify it based on the student's needs. These are just some examples of data collected, and this is what usually your data looks like. You have baseline where you're collecting data without having implemented any kind of intervention, and then when you actually have a stable baseline, you would actually implement the intervention, and then you would continue to collect follow-up data, which should either be increasing or decreasing depending on what you are trying to teach. This is another example of how you could graph data, and in this case these data are for accidents during toilet training, when the student is actually wearing a diaper and when the student is not wearing a diaper. So you would see their kind of testing to see whether the data that they have would be consistent. So they have a set of data when they collected that they collect when the student is wearing a diaper, then they remove the diaper, then they come back to the diaper situation, and then go back to the diaper situation. So once again, this is just another example. This is another example of data collected. Once again, you have the antecedent assessment data, and then for the treatment evaluation, you actually have you have a condition, and the choices there are no choice, choice, no choice, and choice. And the antecedent assessment is actually the baseline data for this particular intervention. Generalization of skills is really critical, and therefore it is an explicit part of the ABA programs. There is a lot of focus on generalization, and by generalization what we mean is that if we teach the student a particular strategy, say for example in the math class, we would like the student to use the same strategy when they go into the cooking class if they are working on the same concepts. The one thing that we have to remember is that generalization does not occur automatically, it has to be taught. Generalization is not an afterthought or a side effect. Once again, we have to be very, very explicit and actually teach students how they can take a skill that they've learned in one setting and implement it in another setting. Generalization is the central goal of any intervention, and it should be. You don't want the student to keep learning and relearning. You want them to be able to take a skill that they've learned, say in a classroom, and implement it when they go out in the field. So, for example, if you are teaching students how to use an ATM machine, they should be able to use any ATM machine that they go to. So if you have an ATM machine in the classroom and that's where the students are learning the skill, they should be able to use the same skills, take those same skills and implement them when they are actually in front of a real bank or when they are in front of a real ATM machine at a grocery store. So, like I said, we have to plan for generalization. It isn't something that just happens. The best way to do that is to teach skills in many different environments, teach with as many different teachers as possible. You want to teach them at different times of the day. You do not do the same thing the same way all the time, so you have to remember to plug that in the training as well. And when skills are learned with discrete trial training, you have to make sure that you practice them in the natural setting as well. And you could actually get the help of parents here, because now parents can take the same skills that the students have learned at school and practice with them at home as often as possible.